hypertrophic cardiomyopathy. In that, there is dysfunction of diastole, clinical signs present during the systole, autosomal dominant with variable penetration, that means family history is positive, some cases sporadic also. The most common cause of hypertrophic cardiomyopathy is ventricular fibrillation. Hypertrophic cardiomyopathy is two types, non-obstructive and obstructive. Non-obstructive is most common, 75%, and obstructive cases are only in 25% cases. In that, the asymmetrical hypertrophy of septum only on one side, that leads to obstruction to left ventricle outflow, and there is subaortic obstruction also, but aortic valve is normal. During systole, anterior mitral valve, it comes near the septum, due to which in echo we see the SAM. SAM means systolic anterior movement of mitral leaflet. In advanced stages, cavity size is decreases, that further reduces size of cavity, that more narrowing of the left ventricle outflow, which produces a harsh systolic murmur. Then in pathophysiology, a mutation in the cardiac sarcomere proteins. Most commonly protein involved in this condition is a beta myosin light chain, myosin binding protein. Second, third one is cardiac troponin T, and fourth one is tropomyosin. On histopath, dearrangement, muscle alignment, that decreases the relaxation, and hypertrophy of heart is it is due to heart is contract against the obstruction, therefore heart is hypertrophied. Some fibrosis also occurs. Then in main pathophysiology is relaxation decreases, due to which end diastolic volume is decreases, and systolic volume is also decreases. Clinical features mainly are palpitations, angina, dyspnea, syncope. Syncope is because of left ventricle outflow obstruction, and mainly drugs, diuretics, digoxin, and nitrates is contraindicated in HCM, because digoxin is when give if we give digoxin is responsible for increase the force of contraction, that decreases the cavity size. As we have already seen in HCM, already problem in cavity size. If we give digoxin, further decrease in cavity size, that hampers the hypertrophy condition. Now, how we treat? We main goal to increase the cavity size, aim to reduce obstruction. We use beta blocker, calcium channel blocker. In calcium channel blocker, mainly we use the verapamil. Then we have also used amiodarone. If not resolved by these three drugs, beta blocker, calcium channel blocker, amiodarone, we do septal myotomy or inject absolute alcohol in hypertrophic septum.